Hello and good afternoon. What if you could treat and potentially prevent migraines without adding another pill? Today, we're unboxing and breaking down the Cefaly Connect, an FDA-cleared trigeminal nerve stimulation device for migraine treatment and prevention. And I'm not just reviewing this as a clinician, I'm reviewing it as somebody who personally suffers from migraines. I'm Dr. Justin Herbert, clinical pharmacist and integrative pharmacy specialist based in North Carolina. I work with complex medication cases, neurological conditions, pharmacogenomics, and I also work extensively with veterans on medication-related disability evaluations and nexus opinions. So today, we're looking at the device from three perspectives: the patient, the clinician, the veteran, and veteran disability strategy. Bear with me as I move the camera. All right, that should be good enough view. See if I can get some music going. Oh, it's being difficult. Well, looks like I'm not going to be able to have the background music that I wanted. All right, let's see what we have here. From the Cefaly box, there's a link. Begin to start the journey. So Cefaly Connected is Bluetooth enabled, connects with the CC Migraine Management app. I got this one from the VA. It's lightweight, curved, and has magnetic attachment. There's a reusable electrode pad. Let's see here. All right, so this is the device itself. Mine came pre-charged. It's got pin number on the back there that you'll need to make note of. For pairing, the USB charging cable. It's standard USB to micro USB, and that goes to one of these charging docks. And so it's simple, just plug in like any other USB, and then to charge it, that's the charging base, and you pretty much just put it on there. And the center connector is going to line itself up. It's pretty magnetic, and so just as long as it's centered on the base, it'll begin charging. Additionally, we have the electrodes, the quick start manual, and it's actually one of the better looking user manuals, but still pretty thick. A few people read them. And then it comes with a 3-year limited warranty that you can register that card. Keep everything together there. And then, all right, so let's get into a little bit about how this device works. So the Cefaly Connect stimulates the suborbital branch of the trigeminal nerve, one of the key pathways involved in migraine pathophysiology. What a mouthful. Instead of suppressing symptoms chemically, it uses external trigeminal nerve stimulation, or eTNS, to modulate pain signaling. It has 2 primary uses: acute migraine treatment or daily preventative therapy. All right, so you'll have, take one of these electrodes. You want to keep the plastic after you use it. And as shown on the picture, there's the device attached to the electrode. Yeah. Not going to read the quick start to you, but there's that. So in a minute, we're going to do a demonstration. The application is simple. You want to clean and dry the forehead, then you'll apply the electrode. Device will then magnetically attach, and you press the start button, which is there on the front. Now, say briefly, you'll feel a gradual increasing tingling sensation. Most people describe it as buzzing or vibrating. Preventive sessions are around 20 minutes, and acute sessions are longer, about 60 minutes. There is an app to this, and this is where it gets interesting. So the Connect app allows you to track migraine frequency, track severity. That's kind of hard to read, there's glare. But anyway, yeah, I made a script. So you can track migraine frequency, severity, treatment sessions, monitor response over time. And for my veterans and active duty service members, this part is critical. For those on active duty, it's very important to document. And if you're experiencing migraines on active duty, documentation will very much matter and will help with any future disability claims. Hopefully your migraines abate and you never have another migraine after discharge or retirement, but it's probably unlikely. While you're on active duty, try and get a diagnosis. If you're Guard or Reserve and you have a deployment coming up or a federal activation, I believe you have to be on Title 10 orders. You could be on Title 32, but it makes things a little bit more difficult. Anyway, for those active duty and those reservists activated to Title 10 federal orders, you should get diagnosed during your active duty time. Begin treatment during service, and then objectively tracking migraines is beneficial. They'll want the data that's close to the time of claim, and that would be after discharge or retirement, but getting in the practice of tracking each and every migraine and mentioning whether or not you had to lie down. The clinical term is called prostrating. So if a migraine is severe enough that causes you to have to lie down, typically in a dark room or on the floor, office with the lights turned off, something like that, that's called a prostrating migraine. So even if a device like this or medication reduces your migraine burden, you'll still want to document diagnosis, treatment attempts, frequency history, functional impact, specifically focusing for VA claims, whether or not the migraine caused or required you to lie down in order to manage the pain or get through the migraine. The app data can help support longitudinal documentation, and this matters. So who's this device for? This may be a strong option for patients who want non-pharmacologic therapy, those who can't tolerate preventive medications, patients with medication overuse concerns, those who are pregnant or medication-sensitive individuals, and veterans who want documented treatment trials. As someone who has tried multiple migraine therapies personally, having a non-drug option is valuable. So if I were counseling a patient on this device, here's what I would emphasize. You want to set the expectations. Preventative benefit takes consistent daily use. Give it several weeks. This is modulation. It's not an instant cure. Sensations. Tingling is normal. Intensity increases gradually. There's a 14-minute time where the intensity increases over that 14 minutes. There's a button in the app, or there's a button sequence on the device itself that you can stabilize it. And so if the intensity becomes too much during that 14-minute period, you can click stabilize, and it will it will set the intensity at that level for the duration of the treatment. Most people acclimate to the ramp up period without issue. I've done one treatment myself, or preventative treatment, 20 minutes, and I let it ramp up to the maximum. Something I need to get clarity on in the literature. There's a what do you call it? 10 milliamps, I believe, was the maximum. I got an alert, and I chose to ignore it versus stabilize and just let it continue to ramp up. I think it was about 60%, and then let it continue up to 100%. I'm going to continue to just let it do it as long as I tolerate it. But I'm curious whether or not the 10 milliamp threshold is optimal. I believe that's what it was studied at. I'm not sure why they allow it to increase beyond that, but it is what it is. It should be comfortable and tolerable. And so they say to limit or to stabilize the intensity where it's comfortable. Could cause some tingling. Could feel like your hair standing on end. It's kind of funny. It can make the entire head buzz. So you want to clean dry skin. You have cleaned and dry skin before application. Should replace electrodes as recommended. They are reusable for a number of uses, but if the sticky gel peels off or something, it's best to get a new electrode. So some of the contraindications: people who have implanted metallic or electronic devices in the head should certainly avoid this unless specifically authorized by their neurologist or medical care team. Should also be avoided in patients with pacemakers or implanted neurostimulators. If you have any of these devices or any foreign object in your body, such as metal, or if, it's best to ask the doctor before starting this. It is prescription only, so just a gentle reminder to mention those things during any appointment where this might be prescribed or discussed. Prevention success depends on adherence. So the more consistent you are with daily use on the preventative sessions, the better. So if you're a veteran or know a veteran who developed chronic headaches or migraines after taking prescribed medication during service or prescribed for a VA service-connected condition, and you're wondering whether there could be a causal relationship to the medication that you were prescribed or are still taking, and onset or increase in frequency or severity of migraines. This is something that I specialize in: medication-induced disease evaluation, also called drug-induced disease. I can provide independent medical opinions within the scope of practice and provide expert witness analysis, written reports, and testimony in the court system if required. feel free to get in contact, whether you need, whether you're a veteran looking for service connection that might have a medication adverse event or side effect as a bridge, let me know. Also, if you're an attorney or work with cases that involve prescription medications and harm, then I can take a look at the case, be happy to, and then determine if I could serve as an expert witness. All right. Before I actually get into the demonstration, which I'll try to talk through it and keep it brief. But final close, if this was helpful, please select like and also subscribe. I'll be reviewing more migraine tools, devices, and medication strategies in times to come. Feel free to drop your questions below. It doesn't look like anybody is watching live stream. This is my first video and also first live on the channel. So if you can comment later, catch the replay and whatnot, then please comment and I'll do my best to respond to them. And if you're a clinician watching this, I'd love your thoughts on the neuromodulation integration into migraine care. So thanks for watching, and I will show you how to apply this. So not specifically recommended, but I figured a baby wipe is probably good. Cleans efficiently and dries relatively quickly. Is it hot in here, or is it just me? I know it's just me. Anyway, just me watching. Okay, so I want to gently, with consistent force, pull that off. And let's see if I can place this. There we go. And the gel does feel like giving a gentle cooling sensation. So I'm going to open up the app and see if I can show you that awesomeness. So it's called CECE. CECE. And when you open the app, for the second time around, once you've paired it, it will ask you for the pin to pair, and then you put that thing right there in the center, and then oh, that's nice. We've softened the screen brightness. It says connections weak. Anyway, so you got 3 buttons there. That is some really bad glare there. What a great reflection. Anyway, so 3 buttons down there: play, stabilize, and ramp up. So you hit play, and then you get a message that asks you whether it's prevention treatment or an acute treatment. Honestly, I think I've been having a headache that's been bothering me all day, or at least is potentially coming on. A lot of neck pain, tightness. Went to massage therapy at the VA. Oh, it was brutal, and I didn't think I expressed that much pain or clenching of my teeth, that sort of thing. But said. I've been, sadistic with you, blah, blah, blah. But I think it opened up some things in the back. This shoulders forward, kind of protecting the rib cage, side effect of computer work or past trauma experiences. There's all kinds of causes. Looking at the phone. But yeah, so trying to roll those back and down, and hopefully that's going to help alleviate some of my neck tension and headaches and whatnot. Thanks. Please wait, and tells me to keep the phone close by. So it starts the 20-minute timer, and it's got stabilize and ramp up, and then stop. Yeah, right now it's at 0%. Huh. I mean, it's counting, so it's on. I don't think you have to hit ramp up to begin with. It goes up by, I think it's 1% every so often. I was going to say every minute, but you won't get to 100 after 20 minutes. I'll try this. All right, a quick stop. Let's see. I have heard that there's some a lot of user frustration with the app. I'm like, it's literally right here to my phone, and it's telling me that I have a poor connection. If you hit ramp up, it gives you, are you sure you want to ramp up the stimulation intensity? Intensity automatically increases in the first 14 minutes of a session. Ideal stimulation intensity is noticeable, but never uncomfortable or painful. You don't need to reach the maximum intensity for Cefaly to be effective. Do I want to increase it or not? I'm going to let it go for a minute and see if it starts to tingle. Still says 0% on me. Got this from a vendor at the VA. Medicated veteran for your protection. Something like that. Hey, it's not even noticeable, guys. Okay. Yeah, we're going to try this again because it doesn't seem to be actually having started. All right, it says connected. Yeah, got a blue light. All right. Oops, that's acute. That's an hour-long one. Maybe prevention is singular. Maybe. Okay. Please wait. I suppose it would be good business for them if they make the app a headache to navigate. 6th or 7th time is the charm. It says the connection is poor. I don't get that. Come on now. Take the thing off. Lucky electrode. You know, it says it could cause some redness at the site of application. No, I did not hit acute. Yeah, this app is giving me a headache. And the constant feedback. Prevent, start treatment. I think purple's good. Yeah. All right. Yeah, I guess that connected. Well, the unboxing went pretty smoothly. And with mine, it came with a little travel case as well. And also not shown, it came with another charging base, which is actually behind me. It's right there if you can see it. It's mirroring my video, which is why you can read the words on my hat, but it makes it very difficult to determine where your hand is in space. Yeah, still reading 0. What a challenging. Jeez, come on now. Well, definitely need some practice in going live. What's going on? Still showing treatment. Huh, still showing it's active. So let me take this thing off. So it's connected. All right. Okay, the app is needed to use device. I thought you were supposed to try to read. Well, I know it's charged. We'll try this again. Oh, okay. Well, pressing and holding it did something. Got it to jump up to 18%. A little bit of tingling. I'm going to disconnect my webcam from this. It's going black for a second. There we go. I'll disconnect that from the whatever you call it, tripod. And reroute the wire. And we are back on my monitor. Hello again. How do I make my background blurred out? Oh. The joys of learning YouTube Studio on the fly. Oh, it gives me a microphone bar. Doesn't seem to. Oh, there it is. Okay, cool. Got my microphone right up here. Should I do it like a podcast? Be my own microphone stand? No. I can share screen. Don't think I'm going to. Don't have access to this feature, which is camera, manage. Doesn't seem I can click on that either. Channel level settings, overlay for breaks. Apparently you need to add the overlay to an encoder. I don't know anything about any of that. Edit. Oh, been there. Now we're at 18%. It's tingling a little bit. See? Oh, I've had this kind of posture so long. Get my shoulders up and over so you can feel it in the shoulder blades. It's it opens things up, but it's like I'm aware of sensations and I just want to do that automatically. After this, it might be time to use my Saunders cervical traction device. It's that'll be a fun one. I have to show you guys sometime. Anyway, thanks for watching and invading my privacy. Hopefully on a replay, since no one is here to watch this live. Announcements must be made in the future, clearly. Damn, I've been live for 32 minutes. That's I'm having a lot of trouble gauging how long it takes to do things. I didn't think it would have taken 30 minutes to do that kind of an unboxing. I guess I'll have to do another take. When I tried to do a take, my new-ish computer with a Windows 11 upgrade on it, and practically nothing on the hard drive. Ooh, there goes a good little tingle that one got back in my head. Oh yeah, it said there wasn't enough space. I'm like, how do I change the storage folder? There's a drive that says it's like got a terabyte free. Computers. No, these are not Meta glasses. These are just the standard bifocals that they issue us old men, old peoples. All right, I'll put that away. My reading glasses seem to be a stronger prescription than the lower of the bifocals. I like this. I'm going to have to remember to order frameless lenses next time. These are my distance glasses for anybody who cares or does not. And is listening anyway. Ad-libbing. Oh, that's not good. So annoying. Okay, 19% got my hair buzzing. It's like feels like it's trying to stand up. I'm in there. Okay, so double click, rapid succession. We'll jump it up. Okay, one click seems to go up 1%. Yeah, sometimes 2 clicks will go up 2%. I don't think I'd ramp this up too terribly quickly. Can get pretty intense. It's a gradual increase. I don't know how often it was, and I'm only at 33% right now. Like, it's tingling through my whole head. It's actually pleasant. It's different, but if you've ever used a TENS unit, it's very similar, but it's like the places that light up on your head and back and neck and face. A little unexpected. I'm going to try and restart this thing since it's refused to like self increase. So I'm going to mess around with the app for a while and see if I can get a continuous 20-minute treatment block done. Come on, give me some percentage. This thing. Cool. Supposedly shot it up to 9%. Okay, so the ramp up button in the app only bumps it up 1%. Well, I'm going to go pollute my lungs, and perhaps we'll talk about smoking cessation or nicotine replacement therapies for those wanting to quit the bad habit. Stay tuned. I don't know when. I don't know where. I know how, and it'll be through YouTube. Presumably. Do I look a little like psychotic, or I might have psychopathy with the non-blinkingness? It's a little creepy, I'm not gonna lie. Anyway, if it would please the audience members, I would be willing to do a very awkward, non-blinking. Okay, I'll probably blink. But anyway, wow, I did not know I could open my eyes that long. Oh, there it goes. Okay, anyway. Oh, I'm back. That was let's call that a light dissociation. I didn't go to a dark place. Anyway, it's on the list of topics that I have credentials or something or other to talk about and experience and all that sort of thing. And perhaps I'll run a smoking cessation group where I too quit for an extended period of time, or simply reduce back to a cigar on special occasion or whatnot. That being said, 39 minutes, still haven't gotten my migraine treatment to start. But hey, if I still have problems, I might reach out to the Cefaly team. As a veteran, they advertised that I would get a free coaching session or something like that. Maybe we can, maybe I can get a little bit more insight into the app, the challenges, and perhaps some hacks. Bye for now.